Hey guys, I'm Michael Allen for TravelCostaRicaNow.com. If you've ever thought about visiting Costa Rica for plastic surgery, a butt lift, some breast augmentation, breast augmentation, this video is going to be for you because we're going to be talking to the expert. He does it. Thanks for talking to me, by the way.
Hi, how are you, Michael? Nice.
I really appreciate it.
Me.
So this is going to be a good one, guys. So let's get into it. So introduce yourself.
Okay. Well, hello, my name is Dr. Victor Ursula. I am a board certified plastic surgeon. I've been in practice for 15 years, and I completed my training in the University of Milano in Italy, and my subspecialty microsurgery in the Pre-operative University in France. And then I did a fellowship in Hackensack Medical Center in New York. And I've been in practice here in Costa Rica for the last 15 years.
Do most people that practice plastic surgery in Costa Rica, do they get their education elsewhere, or is there a good pool of colleges and schools here to do that, or do most people leave to get their?
Well, Costa Rica has invested a lot in education. You know, we don't have an army since 1948, so there's pretty good schools here, you know. But also many of my colleagues, you know, not only in plastic surgery, but in several other specialties, travel abroad after med school for further training or fellowships.
So when I think of plastic surgery, I know this is going to sound stupid, but I think of either like breast augmentation, maybe a butt lift, and maybe fixing your nose. What do you specialize in? Is there way more to that? Is you do other things? What's plastic surgery actually entail? Fixing other parts of the body?
Yeah, well, actually, the name of the specialty, everyone says only plastic surgery, but it's actually plastic reconstructive and aesthetic surgery.
Ah, okay, that makes more sense, actually.
Plastic surgery comes from a Greek name, plastikos, okay, which means to shape something or give form to something, okay? So this is why the specialty is called plastic surgery. And we actually begin our training as plastic surgeons with a lot of reconstructive surgery. So for many years, I was doing limb reconstruction, hand reconstruction.
Like accidents or just anything?
Yeah, facial trauma, you know, like fixing mandibles or, you know, malar bones, or fixing tendons in the hand, you know, or like any type of loss of substance or function. You know, we normally are involved with other specialties like orthopedic or maxillofacial surgery, you know, and we work in teams, you know, or sometimes alone, you know, to fix whatever problem we have.
Ah, okay.
Yeah, and after you become a really good reconstructive surgeon, normally, you know, you start doing aesthetic surgery, and this is how aesthetic surgery becomes a little easier, you know. But we do a lot of breast reconstruction after cancer, you know, and you know, deformities. We are very big into cleft lip surgery or deformities of the breast, deformities of the ears, you know.
Ah, okay.
Yeah. And then, of course, when you learn to do reconstructive surgery, doing aesthetic surgery becomes a lot easier, because normally it entitles a lot less, you know, a lot less, you know, difficulty recreating or improving something that's already pretty okay than fixing something that has a big deformity or that was very altered by trauma.
How long's, I mean, Costa Rica is pretty big now in medical tourism with the, you know, Canada, the United States, other places. When did that start? Has that been going on for like 15 years?
Well, I started my practice, I moved back to Costa Rica like 15 years ago. At the beginning, I went to work in a trauma center, you know, so I was working in a trauma center, and right away I started my practice, and I think I've been doing medical tourism for around 15 years, yeah.
When did you know, but it's really getting big now, right?
Well, yeah, I mean, especially in the last 5 or 6 years, you know, I think it's you know, grown a lot. Of course, you know, word of mouth has a big impact on this in social media. The more people you operate, the more, you know, they post, they tell their stories, you know, and the more happy patients you have, the more they refer you people, you know. So far, I've operated people from 26 countries, you know, not only the US and Canada.
Wow,
but, yeah,
26?
Yeah,
wow.
We had a lot of people from Europe, from, you know, even from Asia. I operated, you know, several people from South Korea, you know, and so Bali came also, like very far away countries, you know. You operate your friend, and your friend's like, look, me, you
I
know,
have somebody for you.
So
when somebody writes you and they're not super familiar with Costa Rica, what are their usually like maybe their top 3 concerns? Do they have do they ask you are people going to be able to speak English to me, or do I have a guarantee of the work? I mean, what do you see kind of as the most frequently asked questions from people that aren't really super familiar with Costa Rica but heard about it maybe through a Facebook thing? Do they write you or email somebody and kind of with a few concerns, like is it safe and is the equipment good? Do you hear any certain questions over and over?
Well, it depends very much where people are from, and where they learn about us, I would say a very large quantity of patients are referred by other patients, so it makes the process a lot easier. But in the last 15 years, we have learned to communicate a lot of this information that sometimes we take for granted. Some people think Costa Rica is Puerto Rico,
Right.
We've had patients who bought a ticket to go to San Jose, California, not to San Jose, Costa Rica.
Costa Rica is a nice island.
Yeah. So, or Costa Rica is a nice island.
Yes.
Well, Costa Rica is located in the center of Central America. It's very well connected to the United States. There's a lot of airlines that come to Costa Rica because we're very well known for ecotourism. Okay.
Right.
There's around 5.5 million people in Costa Rica. It's a pretty small country. 52,000 square kilometers. And we have a floating population of a little over 2 million people, so more or less 2 million tourists come every year to Costa Rica for, whitewater rafting, for the beaches, for beautiful, rainforest, canopying, etc. I think Costa Rica has gotten a big reputation. It's now a destination for people to retire, so there's a lot of people from the US and Canada and Europe that have moved, especially to the north of the country, where there are beautiful beaches. And so this, is a process that, is normally easier now. But regardless of this, we always try to give a lot of instructions to patients, Of course, all the staff speaks English. I speak also Italian and French and obviously Spanish. So that
I am so jealous.
That helps a lot communicating, And basically what we do is we when we're contacted, someone in my staff will answer your questions, and we normally request for pictures so that I understand exactly what I need to do, and then we set up a FaceTime consultation.
So you can do a lot before they even get here, right?
Yeah. Like we normally want patients to come with the blood work from the States and make sure that everything is okay before they travel, Because like if you come here and your, hemoglobin level is very low, then we can't do the surgery and you lose your trip, right? So I don't think you ever lose a trip to Costa Rica. You can always
you can do something,
but you're planning to do a procedure, so. And then we also like to give you the instructions, written, so it's a lot of information, so you can, access that information. A lot of it is in the website, but we always send you like an email with a lot of, the information based on the procedure you want. My staff is, pretty experienced already, so they know exactly what to do. And we basically help you organize everything from picking you up at the airport to bring you to the office, to the hospital.
So you can handhold them as much as they would want to or not want to.
This is people that we have worked with, for a long time already. So they have all the logistics to pick you up, to bring you to, a recovery center. If you want to do some, sightseeing or, not, medicine related, stuff before the surgery, you can, so we can give you all this advice. Once you come to my office, then we turn on the, medicine mode, and then you come here for medicine exclusively. I would normally spend around an hour, with the consultation, a little more if needed, to explain exactly what we're going to do and walk you through the process. And then, we normally have the surgery, and then someone picks you up at the, at the hospital. They bring you to the recovery center. It's all English-speaking, staff.
Which obviously helps.
There's around 8 nurses in the recovery center, so they help you bathe, they help you take the dressings. If you need something for pain, they give you that for pain, and they bring you back and forth, to my office, and that's basically how the process goes. Depending on the surgery you do, we request you to stay, you know, the time after, so we can do proper follow-up, you know. And ideally, we don't want you to leave the country unless you're ready to leave the country. You know?
Right.
So that's something also very important for us. You know, we
recovery.
Really, yeah, we want to make sure that you come here and that you get a very, you know, complete service and that you're 100% ready and it's safe for you to travel back home.
So obviously, you have 26 countries. You see a lot, but what are kind of the top 3 or 4 that you do here? I mean, that you get a lot of. Is it the nose? Is it breast augmentation? What are the big 5 for you that you seem to do a lot of?
I do a lot of breast surgery, you know, from aesthetics to reconstruction, and I also do a lot of facial surgery. A lot of seniors. There's a big community of seniors here, especially from the U.S. and Canada, that live in the country. You know, so I've operated many of them, and then they tell their friends, or when they go back for vacation, it's like, wow, you look amazing, you know. So I had a facelift. Oh, who did it? You know, so
that's,
you know, yeah.
Referrals got to be big here.
Yeah, exactly. So I do a lot of, you know, facial surgery, a lot of breast surgery, you know, body contouring also, you know, like liposuctions, high definition liposuctions, tummy tucks, you know. Yeah.
Wow. So how do you? Now I know it depends, obviously, on the individual, what they're having done, but how do you consider the cost of something? Because a lot of people, that's the first question they always ask me. Oh, you talk to that doctor, how much would it cost for me to do my breast augmentation? Well, obviously I know that depends, but is there any kind of ballpark figure? How do you choose the, what are the variables that change the cost of something?
Yeah, I think the most important thing is, you know, to look for quality, you know, rather than price. You know, you're operating your nose
because you're getting a lot of you're getting a lot of things that are more than just the
exactly. You want to make sure that you're getting a good, you know, result. You know, and you know, I mean, according to the American Association of Plastic Surgery, 1 out of every 4, you know, noses needs a revision. So it's pretty high, you know. So you really want to make sure you pick the right doctor, you know, to do the procedure. Surgery is never a game, you know. It has to be taken very seriously, you know. And I know the price infrastructure of everything is very important, but also having a nice experience, having a nice result, you know, feeling that you're not just someone else, you know, through these processes.
I've noticed that a lot. Johnny's taken me to a lot of places in the last year and a half or so. The biggest thing that I see is a personal touch. You know, you feel like you're somebody when you go in there, that they actually care about you, instead of this, okay, here comes another one, get ready. You know, it seems you get a little bit more personal.
Yeah, you know, I think it's a little bit in our culture as Costa Ricans. We're very curious people. We're, you know, very polite people. You know, we like to meet new people. We like to talk to people. We like to listen to their story, you know, and we have the time to do it always, you know. So, and I mean, in this field where we are, you know, like, I mean, you need to understand exactly what you want to get as a service, you know, so that I can do the right, you know, procedure.
Right.
Sometimes people have a misunderstanding of what they really want, you know, so, or what it takes to get there, you know. So this educational process, I find in plastic surgery, is very important. Everything in medicine requires a lot of education before you actually do the surgery. So I think we focus a lot on trying to explain to you really well how a certain procedure is performed, what you can expect from the procedure, what are realistic expectations that you're going to have from your procedure, what this procedure entitles, you know, and then we customize this to your need, you know. So we will always, you know, send you a quote based on exactly what you want, you know. Many people...
It's kind of a custom package in a sense, right?
Yeah. Many people want to do different things, you know. Some people come and they tell you, look, I want to have a breast reduction and liposuction of my lower back, you know. So we, you know, basically customize, you know, what you need, you know, and we do our procedures in very good hospitals, really well-equipped hospitals, world-class, you know, equipment. And this also helps us with safety, you know, which is the most important thing. You know, last thing we want is that you have a complication in a foreign country. So we really try to focus in doing it really well since the very first moment, making sure that you're a good candidate for the surgery, making sure that we're not doing way too much surgery. Like sometimes it happens.
Do you ever say no?
Yes.
Do you go, I'm sorry, you're not, they don't need to be this big. We're not doing it. You're going to have health problems later, and you're going to regret it, and I'm not doing it. But because I think some doctors would go, well, I'm just doing what they want, and that I told them all the precautions. I told them this, this, and this, but they said yes anyway. Where's that line?
No, well, this is what, you know, experience gives you, I think, you know, in training. You know, you can never, I mean, it's very, very difficult that you can always say yes, you know. I think it's very important that, you know, you help the patient understand the limitations, you know. And of course, if they're good candidates, you know, there are some people who need a gastric bypass, not a liposuction, you know. So, and if I bring you here to give you a liposuction when you need a completely different procedure, I mean, I'm not being very honest, and I'm not, you know, telling you exactly what you need, and perhaps I'm putting you to a risk, you know. So it's very important, you know, and very often we have to tell patients, no, you're not a good candidate. It's too risky to do this for you. You need another surgery, you know, with someone else before we do a surgery for you, you know. There are people who have important medical conditions that are, you know, to be taken care of before we do aesthetic surgery, you know. So it's very important, and this is why we always do this consultation, you know, on FaceTime, so that you can meet me and so that I can meet you as well. So you tell me exactly what your goal is, you know, what your medical conditions are, previous surgeries, you know, logistics. Logistics is a big part of this, you know,
right.
So that we understand exactly, you know, what you need, and then we can tell you, okay, perfect, we're going to do it this way, or no, I don't think you have to do this. You need to go somewhere else before you come here, you know. So that communication is very, very important, you know. In communication is super important in everything in life. And when you're having surgery, it's 3 times as important.
So you can do some of that prior to coming to Costa Rica?
Yeah. So basically we have a contact, you know, and the staff will see the contact, you know, they will understand what you want, and they will tell you, okay, look, I'm interested in having a surgery for my abdomen. Okay, please send me pictures of your abdomen. They send pictures of the abdomen, I see the pictures, and I tell them, okay, schedule please a FaceTime consultation. We will have that FaceTime consultation. I allocate an hour, you know, at a certain time, you know, and I tell you, look, I saw your pictures. I think this is what you need, or no, you need this and that, you know, or, you know, basically we customize it based on your need. And then, you know, after you understand well what the surgery entitles, the time you need to stay in Costa Rica, etc., then we move forward with the rest of the process, you know, and we book your date for surgery. You need to arrive to the country a couple days before surgery. So depending also on where you live, if you're flying from Europe, we normally want you 5 days before the day of surgery in Costa Rica. If you're traveling from Florida, you know, a couple days is enough, you know. So it also depends on the length of the flight, you know, because, you know, this can increase risk of DVTs, you know, and other problems. So we basically will ask you for the, you know, pre-op, you know, labs, or, you know, cardiac evaluation from your doctor, or, you know, whatever we consider necessary. And then once we have all this, you know, paperwork ready, all the understanding is, you know, in place, of instructions, what to do, what not to do, we can then book a date, and then patients normally come here, they go see the volcano, or, you know, whatever activity, then they come to the office, we have a formal consultation, and then we do the surgery.
Nice.
And then, of course, all the follow-up after the surgery before you're ready to go home.
So you're like an artist. So what do you have a favorite surgery you like to do? You know, in a sense, do you have something that like you feel like an artist and doing something? Do you have something your favorite stuff to do?
Well, I really like all plastic surgery, but I would say what I really love doing is facial surgery in general and breast surgery. Yeah, those are my 2 favorites.
Because it's very arty. You're reconstructing.
You have to understand. I mean, plastic surgery is a gigantic specialty. You know, like we take care of a lot of different, you know, areas in the body. You know, and maybe those 2 are the things that I like the best.
Mike, he's being modest. He's also done a special way of reconstructive surgery. So I think he should talk about that. He's got a special way of doing reconstructive surgery that he's designed himself.
Oh, really?
Yes.
Well, I didn't know that. What's he talking about?
Well, you know, some years ago, a group of patients started to notice they had, you know, certain symptoms, you know, that they started to associate with the breast implants, you know. So I've operated a lot of people with this, you know, situation. And basically what I do is something called an en-bloc resection. We remove the implant contained by the biological capsule that the body forms around it, okay? And then I invented a procedure, it's a flap, you know, that I call the U-flap, you know, to regain volume and give a nicer shape to the breasts after the surgery.
Oh, wow.
Yeah.
So,
it became a very popular surgery.
That's nice.
He's being modest, but it's something cutting edge. So he designed it, and he helps people that sort of wouldn't have an opportunity to have full breasts.
Ah, very nice. Well, thank you very much for kind of giving us the 101 on what you do here.
No, my
And,
pleasure.
Like, I definitely see why Costa Rica's, you know, getting big, and it's not just because it might be a little cheaper. I think it's all those little variables that you just said.
Yeah, you basically are getting very good quality services, you know, good quality medication, good quality OR equipment, you know. So,
Right.
you know, and this is something that I'm very focused on, you know, like I really want that people have a good result and that we do this with safety, because, you know, you're traveling abroad to have a service done, you know.
Right.
And, you know, I'm very happy, like, I have a lot of patients who are traveling to Costa Rica not for prices, you know, but for quality of services,
Right.
you know, because they saw their friend who had a really good result, you know, and they want that type of result, you know. So this is something that and it happens the same with the dental, you know, segment, you know, there's really good dentists here, you know, and they normally have very, very nice results, you know. So people like to come, and sometimes my brother is
I did
a
it here.
implantologist. Oh,
I
there
did
you
it
go,
here.
you know. So
Like he cares.
Well, I think it's coming through, and I like that. That's why I like these people you connect me with, is a step up from just the regular people that do some of these things. I like this. This is why I like to tell people, you know, if you're interested, guys, wherever the camera is, if you're interested, I'm going to send you over to my medical tourism guru, Johnny, and he can make all this happen. And you could be FaceTiming Dr. Victor in about 5 days. No. Anyway, thanks a lot. I totally
My
appreciate it. And I hope
pleasure.
your leg heals soon.
me too, man. I
You know,
hope.
those bulls,
Yeah.
those bulls, man, you got to quit riding them.
Yeah, I
You
have
got to
to
quit
stop
riding
doing
them.
Plastic surgeon on the globe.
All right, guys, I'm Michael Allen, travelcostaricanow.com. Hope you enjoyed that. Peace, guys. Hope it helps.